basis, educate people about healthy lifestyles, and do their risk assessment using AI algorithms, and refer them next level of health services. And that actually develop their continuous health record that I said earlier, that ensures health inclusion through having a digital health account and accumulating all the health activities. And using that data, we can able to develop a risk prediction algorithm if they have a future risk of stroke, heart attack, diabetes, and so on. So you can see this is a glimpse that how the blood glucose was measured. So it's like a traditional things, but you're putting a blood and there is no display. The display is a smartphone, and instantly smartphone have an algorithm to showing your blood glucose level, and with a color code it's showing where to go. So here just I'm showing you one video so that you can understand the things very clearly.
ডিভাইস ব্যবহার করে ঘরে বসেই করা যাচ্ছে প্রয়োজনীয় স্বাস্থ্য পরীক্ষা। হাসপাতালে দীর্ঘ লাইন ও টেস্ট অতিরিক্ত খরচ বাঁচাতে জনপ্রিয় হচ্ছে এই হেলথ টুলস। এর মাধ্যমে আক্রান্ত হওয়ার আগেই স্বাস্থ্য ঝুঁকি পরিমাপ করে অনেক ক্ষেত্রে মৃত্যু ঝুঁকিও এড়ানো সম্ভব। দেখুন মুজাহিদ শুভর রিপোর্ট, ছবি তুলেছেন শরীফুল ইসলাম রুবেল।
স্মার্ট মেডিকেল ডিভাইসের মাধ্যমে মোবাইলে রক্তের নমুনার তথ্য প্রবেশ করিয়ে শরীরের ডায়াবেটিস পরীক্ষা করছে সার্জিনা। স্মার্ট টুলস ও মোবাইল অ্যাপসের সমন্বয়ে ব্লাড প্রেশার, পালস, ব্লাড অক্সিজেন স্যাচুরেশন, শরীরের তাপমাত্রা, ওজন ও উচ্চতা অনুযায়ী ওবিসিটি পরীক্ষা সহ নানা ধরনের স্বাস্থ্য পরীক্ষা করছে এই তরুণী। পরীক্ষা পরবর্তী ফলাফলে সার্জিনার সবকিছু ঠিক থাকলেও ধরা পড়ে উচ্চ রক্তচাপ।
হসপিটালে না গিয়ে ইজিলি আমি 10 মিনিটের মধ্যে সমস্ত টেস্টগুলো করে ফেলতে পারছি এবং ইনস্ট্যান্ট রেজাল্টটা পেয়ে যাচ্ছি।
প্রয়োজন অনুযায়ী স্বল্প মূল্যে স্মার্ট হেলথ টুলস কিনে একটিতে 10,000 বার পর্যন্ত স্বাস্থ্য পরীক্ষা করানো সম্ভব। তবে পর্যায়ক্রমে এলাকা ভিত্তিক সেবা কেন্দ্রের মাধ্যমে 100 টাকায় 10টি স্বাস্থ্য পরীক্ষার সুযোগ তৈরি করে দেওয়ার পরিকল্পনা সিমেডের।
যেহেতু এই বয়সে আমাদের একটু চেক আপটা বেশি করা লাগে, তো বারবার হসপিটালে যাওয়াটা বিভিন্ন দিক থেকে বিড়ম্বনা না।
হসপিটালে পার টেস্ট 200-300 টাকা করে খরচ হইতেছে, যেখানে আমরা এখানে 8-10টা টেস্ট মাত্র 100 টাকার মধ্যেই করে ফেলতে পারবো।
এটা যদি আমাদের হাতের কাছে আগে থেকে থাকে তো আমরা আগে থেকে সচেতন হতে পারবো।
আন্তর্জাতিকভাবে স্বীকৃত হওয়ায় ডায়াগনস্টিক সেন্টারের মতো রিপোর্ট প্রিন্ট করে চিকিৎসকের শরণাপন্ন হওয়া যায়। প্রতিটি ব্যবহারকারীর অ্যাকাউন্টে হেলথ ডাটা রেকর্ডের সুযোগ থাকায় পৃথিবীর যে কোনো প্রান্ত থেকে তা দেখার সুযোগ রয়েছে পরিবার প্রিয়জনদের।
আমরা কর্পোরেট অফিস, গার্মেন্টস এবং শিক্ষা প্রতিষ্ঠানে প্রিভেন্টিভ হেলথ কেয়ার সার্ভিস দিচ্ছি। আমরা স্মার্ট স্বাস্থ্যকর্মী ডেভেলপ করছি, যার মাধ্যমে প্রত্যন্ত অঞ্চলে জনসাধারণকে কম মূল্যে স্বাস্থ্যসেবা পৌঁছে দিব।
এদিকে সাধারণ মানুষের স্বাস্থ্য সুরক্ষায় জাতীয় আইসিটি পুরস্কার পাওয়া সিমেডের মতো অন্যান্য প্রতিষ্ঠানকেও সব ধরনের সহযোগিতা দেবার আশ্বাস আইসিটি মন্ত্রণালয়ের।
দেশে এবং বিদেশে যাতে তাদের এই সলিউশনগুলো, তাদের এই সার্ভিসগুলো যাতে সরকারের প্রয়োজনে, নাগরিকের প্রয়োজনে ব্যবহার করতে পারে, তার জন্য আমাদের সহযোগিতা অব্যাহত থাকবে।
So you see that how things works, and we actually try to capture our research innovation for all the people of Bangladesh, and that's why we segmented the people that who works in offices. They need to have a preventive and primary health care and referrals, and who live in the rural areas, they also need the health care in the doorsteps, and other people who are in the trouble. So we cover all the people, and we developed a model like a Uber in healthcare systems. So you can see that in the corporate offices and factories, our system are using to provide the healthcare service and getting their good health and improving their productivity. And on the other hand, in the rural areas, we actually develop a catchment area based general practitioner model, where you can see that in one union, one doctor, qualified doctor will be the house there, and also under them there will be a number of paramedics who actually supervise 15 to 16 health visitors. Each health visitor look after 500 to 600 families. So health visitor go to the doorsteps and use smart medical kit and our AI-based algorithms to actually do a doorstep health checkups, and based on their health risk, they refer to their doctors. So in that way, everyone having a health account, regular health checkup, and timely referral that will prevent their diseases as well as improve their quality of life as well as productivity. So let me show you the how rural model works, and so that you can think of like how a local technology can solve the healthcare problems.
Although everyone is familiar with Facebook or bank account, but few of them are familiar with the health account, where the detailed information of the health condition of a person can be stored over the decades. Health Visitor has given us a health card at only 100 taka for a year. We get health services using that card. Health Visitor came to our house and checked our health condition using smart devices. We don't need to go anywhere. We're getting health services at home. From newborn to people of all ages, everyone owns a health account in Shumbhag Union. Primary health care of each person is regularly checked and followed up under the supervision of 1 doctor, 2 assistants, and 14 health visitors. As I'm pregnant, the health visitor gives me effective advices and I follow them regularly. A sample of blood has been taken from my finger and put it in the smart device to check my blood sugar, and they found diabetes. After finding the high blood pressure, the health visitor suggested me to consume less red meat. If there is any pregnant mother in the family, she is given iron tablets. Thus, the regular illness in our daily lives is also checked by our health visitors and doctors. And we also provide referrals, treatment, and follow-up for the patients. After analyzing the data of digital health accounts, it is observed that 16% of total population are suffering from diabetes. 11% have high blood pressure and 25% are suffering from obesity or overweight. Once in every month, each person is screened for 10 tests and get appropriate health advices from doctors and health visitors. We will include 20 new services so that people can get vital medical tests like ECG, ultrasound, and other services at home. People will be able to know their health conditions at home without visiting to remote hospitals and can take preventive measures by knowing about their health risks early.
So you can see that every citizen have a health account, they're getting the health service, and you can see every health workers when go to the doorsteps, they can open their family account, and every person is separate, like a father, mother, that their son and their daughter and their grandfather. So, and then everyone's have a symbolic information that who have a diabetes, who is pregnant. So that everyone is highly efficient to provide the service and take care. And also when it comes to doctors, doctors see all the health records and all the measurement and test and provide the informed treatment in an efficient way with less time. So, and also the data is generating from the system is highly efficient, and we can monitor health data, we can monitor the efficiency of the healthcare providers, and so we can also use the data for who is sick for this month, and so that we can use the data for developing and improving better system every day. So these are the services which is happening every day. So you will be happy to know that using a rural model, we are actually serving 1.6 million people, which covers 51 unions all over Bangladesh. And this year there will be more 100 unions will be joining in these systems, which will cover more than 5 million users. And this model is already recognized internationally, and from Switzerland Global Innovation Award and National University of Singapore and many other awards. So now you can see we just covered only 50 unions. In Bangladesh, we have more than 4,500 unions, and we are learning every day and doing research, improving solutions, and impacting many people. So we are now thinking of like, how can we improve many people, more areas? So this is a put for thought for all of the audience. You can see here that in Bangladesh, this is our healthcare systems. In our community, there is a community clinic, private clinics, union health office, health centers, Upazila Health Complex, and many more. But the problem is due to the not established referral system, structured healthcare system, and not enforced catchment area, people are moving around. How someone goes to community clinic, someone goes to Union Center, someone goes to Upazila Health Complex, someone goes to private hospitals. That lead to like long queue in the health complexes, and as well as you see like a beds in the floor. We don't want that. Okay, so we need to establish a solution like that. So we have to have a health worker who go to the doorsteps, give the regular checkup, and find out the health risk and refer to the community clinics. And then there will be a GP center in the union level, which is somehow missing in our healthcare systems. We are trying to establish it, and then with referral, they will go to the next level of healthcare. If we can able to do that, we can able to achieve structured referral system in every Upazila, every districts. We can have a structured health service and catchment area based systems, and so that we don't want to see this kind of queue and this kind of like people, patients are in the floor. We want something like that, and that will ensure good quality doctor-patient consultation and relationship, and which actually helps to create health inclusion. So digital means for providing comprehensive, preventive, and primary healthcare for everyone, so that we can achieve universal health coverage. And so you see what we are trying to do in research, innovation, and implementation, that household to community clinic to union to Upazila to district to medical college. In all the levels, every citizen are tracked, where they are, what happened to them, and how their health will be more like efficiently managed. And you might be surprised to know that these kind of things may be very expensive. Based on our experience of work in 5 years, and we calculated this is not expensive, and it is this comprehensive system we can able to manage just 100 taka, which is $1.1 per month per family, not an individual things, and which is a less than a price of a coffee in like in Dhaka or in other part of the world. So we can able to do that if we work together, and we can make it happen. So you will be happy to know that recently we actually signed the agreement with one of the big group of companies to establish GP model in Bangladesh. So this is a proud moment. I would like to say that we are celebrating 50 years of Independence Day in Bangladesh on 26th March. And this 26th of March, we are introducing first digital GP model for the in Jamalpur in Malando, Upazila. So which gives me immense pride that first GP model in Bangladesh, we are contributing for achieving structured healthcare system for universal health coverage. And we believe in 10 years using technology and our collaborative effort, we can do that. I just would like to share some of our researches that we are currently doing and we also applied. So during COVID-19, as I said, that if we have the capacity, we should be agile. And when COVID came, that didn't give us time to actually think and work slowly. So immediately, based on our experience, we in our lab and in our organizations, we developed AI-based COVID-19 surveillance system, which ensures public awareness, digital screening, and patient identification and referral. And most importantly, we actually deployed more than 15,000 health workers of the government who are working in community clinics, and they use the whole system and serve people. How? You can see that intelligent system that actually used by the health workers in the community level, they actually go into the doorstep and do the screening and the referral, contact tracing, and so on. Or people go to the community clinic, they are screened, and based on their screening, they are referred to the next level of services. If I say bit details, here that all the people are worked, and then high-risk patients are identified, they are connected to the doctors for sample collections, and then they will be connected for the lab test. If their test is negative, is fine. If positive, they will connect to the hospitals. We can also able to track who recovered, who not recovered. And most importantly, using the data, we actually used where to put more resource, where we need less resource. And that actually help us to manage the patient very efficiently. So you all might use this application. It's called Ddhs Dashboard App, which every day tells us that how our COVID is progressing. Every day we can see the COVID cases are reducing or increasing every day. So, and also we know that in Bangladesh, we don't have the capacity to build many ICUs, and we actually developed a smartphone-based ICU solutions to quickly deploy in a hospitals where no ICU is there. We can easily convert a hospital ward into a ICU using this kind of IoT, AI, and cloud-based technology. So this is, here I'm showing that we can actually convert multiple hospitals and have a strong monitoring system centrally to monitor each patient in the hospital, in the quarantine center, all as well as at home. And also we build our customized contact tracing systems, and that actually effectively utilized for contact tracing. And it helps to prevent diseases like COVID-19 transmissions. So you will be happy to know that we actually served more than 2 million people during COVID-19 using our COVID-19 surveillance systems. That gives me proud that the knowledge we actually acquired, we contributed for the people. And that should be the motto of all the citizens. So I would like to share you some of our more research as well. So we have a Ddhs and other solutions. I'm going quickly to actually give you food for thought so that you can think to contribute this kind of solution as well. So in Bangladesh, there is many children have autism, and among them, many of them cannot speak. So that actually prevent their growth and development, and they get angry. To improve this situation, there is a number of solutions exist all over the world, but that solution might not fit for Bangladesh, and it is very costly. To actually address this problem, we developed Ddhs, a mobile app-based solution, and which actually use the algorithm that helps to express the desire of a children. And you will be happy to know that using this technology, number of child, they didn't able to speak, and now they're able to speak. I would like to share you one of the case study. Is a Monim. He is 11 years old. He never speak. Now using these systems, 1 year, in 2017 and 2018, he now able to speak. He now able to go to the normal school, and he sing a song. That gives the opportunity to contribute and making impact from the research to like implementations. So let me share you 1-minute video about the journey of Monim.
এখন বাংলা ক্লাস বাংলা খাতা দাও
স্কুল ফর গিফটেড চিলড্রেনে সে ভর্তি হয় মারফু আপার কাছে, এবং স্কুলে সে তার প্রথমে অনেক প্রবলেম ছিল। সে কমিউনিকেশন করতো না, কথা বলতো না, চোখের দিকে তাকাতো না, আই কন্ট্যাক্ট করতো না, কোনো কিছু ইন্ডিকেট করতো না। স্কুলে যাওয়ার পরে সে আস্তে আস্তে তার এই প্রবলেমগুলো সলভ হতে থাকে। আমরা বলতে চাই একটা অ্যাপস ওকে ইউজ করাচ্ছি। এই অ্যাপসটার ফলে ওর ডেভেলপমেন্ট খুব র্যাপিড হয়েছে, এবং এখন যেটা হয়েছে তার কনসেন্ট্রেশন ডেভেলপ করেছে। সে কাজ বুঝতে পারে খুব র্যাপিডলি, এবং সে কোন কাজটার পরে কোন কাজটা করবে এই সমস্ত কাজের সিকোয়েন্সগুলো বলতে চাই অ্যাপসের মধ্যে ইনস্টল করা আছে। অ্যাকচুয়ালি এই অ্যাপসটা ইউজ করেই ও র্যাপিড ডেভেলপমেন্ট হয়েছে, এবং ও এখন অনেক ভালো আছে।
So you see that how the child never it was a non-verbal, now he is a verbal and he's have a good quality of life. And now we are developing both the child plus, which is adapting intelligence and generating the progress report for every child for the SLTs, caregivers and parents as well as teachers. So we also developed a Bangladesh fast cancer registry system where we track all the cancer patient through the oncologist and use the data for better treatment development. And we also working on autism screening system development for reaching all the people in the remote areas. We also developed a system for eye checkup at the doorstep of the people, especially in rural areas, and based on their eye problem, they will refer to the different hospitals and doctors. And recently we developed a breast cancer screening protocol. We found that no existing protocol that actually used in developed country not worked for Bangladesh. So that's why we developed a breast cancer screening protocol. We also developed Parkinson's screening protocols for the patient to screen Parkinson's. We are working on Alzheimer's disease to improve and screening of Alzheimer's so that we can connect them resources in the right time. And we're also working on the depression using mobile application and AI as well as brain-computer interface. So doing all of these things gives the opportunity to improve the healthcare systems, to address all the problems that we mentioned, and we can improve the productivity and quality of life of the 2.5% of the world. And just I'm just giving you thought for you that brain-computer interface is a new era of health, entertainment, education, and everywhere. So that means you can utilize your surroundings, not your physical hands or eyes or your sensors. You can just imagine and you can control. That's the power of brain-computer interface. We are working extensively on brain-computer interface, and you will be happy to know that we have the extensive devices for the brain-computer interface, including 64 electrode EEG device in our lab, and we are extensively working and developing many devices, many tools for research, innovation, and knowledge transfer for commercializations. And you can see here, we developed some of the solutions to control lights using brain signals or control phones using brain signals. And now using our 64 electrode, we are developing a deep depression protocol to actually identify the biomarker for the depression with the psychiatrist. And also we are working to develop fast tools in Bangladesh for helping marketing people to actually understand the human psychology for better promotion using brain-computer interface. And also we are using brain-computer interface for education and improving concentration and attention for the people. And all of these things happen due to the team of AIMS Lab and CMED, and that gives the opportunity to work more. And based on our effort, we actually established a first medical engineering technology conference in Bangladesh 2016. And we actually regularly organize neuroscience, brain engineering schools from 2017. And you can see here, and as Professor Dolon said, that we introduced first brain stimulation surgery in Bangladesh, which is a proud moment for our country. And we also continuing our activity. So we always think that it's not about working for us. We need to working for the whole ecosystem. That's why we actually organize training sessions, R&Ds, like promotional sessions for actually involving many people so that we can develop many skilled people for addressing our problems. And I'm happy to share with you that I am very much involved with WHO and ITU AI for Health initiatives. And these are some glimpses that I'm involved, and I'm actively working AI for Health for developed country and developing country. And these are some recognition that actually we got. And I would like to thank you, my team in the AIMS lab and CMED Health, around 65 team members who are working day and night with a vision that one day Bangladesh will example for a digital healthcare systems around the world, and we can thrive together. And I would like to also thank you, all my mentors, all my partners, all my funding organizations who actually supported our initiative and help us to come this position. And we believe technology have the power to make innovation and impact and continue smile of these people who need the most of our effort to actually have the develop Bangladesh 2041. And thank you so much. Thank you for giving the opportunity.
Thank you so much, Professor Mamun, for your nice presentation. It's a detailed overview, and your, I think it's your vision, how we see our Bangladesh in future, actually in digital healthcare, health monitoring system. Thank you for everyone. As the regular connectivity with Professor Mamun, I know he's doing tremendous effort to do something for our people, actually for the N-level people and rural people. So thank you so much, Professor Mamun. And now this time is for the audience. If you have any questions regarding this presentation, I would like to respond from audience side. Please raise your hand, or you can write your question in question answer session.
Assalamu alaikum, sir. My question is like many times our society may not accept your initiative. Okay, like, you know, society is something different. Like they always feel comfortable to depend on doctors instead of just a device. So what is your plan? What is your future plan about it? Like how are you planning to make it more friend to our normal people? Okay, you know how, and I want to know your mind. I want to know your plan about changing the mindset of normal people, general people. Thank you very much.
Thank you so much. Very, very so this is normal, right? Nothing
Yes,
changed overnight. Everything need time, and this is your job. Innovation not on the technology, innovation in everywhere, in the marketing, in the business, in the all over the places. So what you need to do, you need to have a patience, and you need to be resilient, and you need to stick with your dream that one day there will be a time people will understand you. Before that, you will face a lot of difficulty. If I can tell you, last 5 years, I failed lot of appreciation, lot of negligences, lot of challenges from many people. But what I did, I have to believe myself. I'm doing the right things, and I'm doing the things for the people, so that if you continue your vision and work for that, it might take 10 years to achieve the goal. No people succeed in 1 year. So like for myself, my dream is to reach my dream healthcare system by 2030. So I just passed only 5 years. I have another 10 years to create this system that will make Bangladesh proud in all over the world. So that's my answer is be resilient, be patient, and do what you believe.
Thank you. Here in question answer box, here is a question. How do you think the gap between industry and research sector can be bridged in a developing country like Bangladesh?
Okay. Thank you so much.
That's the question.
At the beginning of okay, at the beginning of my presentation, I already said that we need a industry economic collaboration. We need to take the advantage of it. So at this moment, there is a two-side responsibility. From the academia side, we professors, what we need to do, we need to be proactive. We don't need to be traditional. We need to be modernized our concept, our activities, so that we need to develop our young mindset to be the industry ready, so that they will solve all the problems, attitudes in the university. And on the other hand, industry side, industry people need to appreciate the small efforts of all the academias, so that they will come to the university, tell them that my industry, my area has different problems, could you solve it? And again, academia need to appreciate and welcome the industry people, so that it's a bilateral effort. Like if I actually offer my hand for a handshake from the academia, if the industry people will not offer a hand, there will be no handshake. Similarly, opposite, that industry people come to the university, we academia not appreciate it and offer our hand, there will be no handshake. So give you my experience. 5 years ago, when I actually go to different doors, different peoples, that I have a research outcome, can you help me to commercialize? I can tell you, I went to the many big companies, many big hospital owners, and everyone said, this is too early. This is too early, and doctor will be your enemy. You cannot do that. So, but what I did, I take the my courage to actually build a company by myself, because I had the experience that I did a medical device commercialization in Canada. So I had that experience. That's why I came out. Now I found that people are now believing on me, so people are helping me. So that's why I said we have to be very, very proactive rather reactive, so that one day after 5 years, we'll find industry people are actually frequently coming to the university to actually solve their problems. And again, we go to the industry that we have a solution, take it to the commercialization. It's a continuous effort, and one day it will happen.
Any more question from audience side or audience poll?
Thank you, sir. We have learned a lot from your presentation. What kind of challenges have you faced while collecting data for conducting your research?
Okay, this is very common question I always face. When I just getting the service, people are always, if people are very educated, their question is, where will my data, how will you secure my data? What will be about my privacy of the data? And on the other hand, the people who are not very much educated, they are highly accepting this solution. So this is one of the challenge, and on the most important challenge is willingness to pay. So Bangladeshi people are very reactive. If they get sick, they can spend 10,000 taka on the spot because they are sick. That is reactive. Rather, if they are proactive, they take the preventive health care only $1 or 100 taka, so that they don't need to spend 10,000 taka. But culturally, people of Bangladesh are very reluctant on their health. Let me give you one scenario. In Bangladesh, we have 5 things needed. We need clothing, we need food, we need housing, we need education, we need health. Among these 5 essential needs of a human in Bangladesh, everywhere we progress significantly. In food, everyone having a food, and no one are hungry nowadays in Bangladesh. Everyone have a cloth, everyone have a housing, and we also have a education. There is a huge effort made in education. If girls go to the primary school, high school, they're getting the money. But one of the things is highly neglected is health, and people mindset on health is not up to the mark yet. So this is the biggest challenge I could face and facing every day. So now this is the time we are educating people. But one thing I'm positive, if people understand the need of it, people are taking the advantage of it. So these are the challenges we face, and there is many other challenges. When you want to drive a flight, there will be always a lot of challenges naturally and artificially. So your job is to stick with the vision and drive for it and achieve the goal, because our dream is to reach 100 million people and creating health account of 100 million people in next 10 years. So this is not an easy journey. We just completed only 3 million. We have to go another 3 millions to work hard, and challenge is a part of the life.
Thank you. We have already actually run out of our time. So I accept one more question. That is the last question. Dear audience, if you have any questions, you can mail Professor Mamun. I know he is always willing to help our students. He is always willing to help in research and development. So another one is Muhammad Arafat. Anyone else to any question from your side, dear audience? Okay. Actually, at the end of this, I am very lucky that I have 3 projects with Professor Mamun. Now we are continuing this project. Hopefully, within very short time, we'll get good results from our research work. Thank you, Professor Mamun. As we are at the end of our keynote session, thank you very much joining with us. I think our students and our audience can learn much more about our health system, actually, what is the condition of our digital healthcare or healthcare in Bangladesh. I hope we will work. This is the primary healthcare system. Will work for secondary and then another advanced level healthcare system from your side and also from our Bangladeshi researchers. Most probably,
I would like to add one thing, Professor Dolon, that I think all the students, you need to actually think in a way that you need to solve at least one problem in your student life. So what do you do in your 4 years of student life? You just identify a small problem in your surroundings, in your society, so that you can address it. I can tell you, Professor Dolon is one of the example. He is driving in his different building, different departments, different research things. So we need many professors and many students to work together to actually make realize our developed Bangladesh. So I really appreciate Professor Dolon for inviting me and giving me the opportunity to actually share my experience. And we are working together, and we will continue our work and impact many lives.
At the end, one question we have here from Arafat Uddin Sharif. How did you manage the cost when it was very initial stage? Because it was not possible to continue without individual fund, I guess. This is a question from Arafat Uddin.
This is a kind
common
of
question. It's a common question from our side.
This is a common question, as you said, and this is all about management. And you know, engineer is a better manager than normal other people, right? And you will find in Bangladesh and all over the world, many CEO of many companies, their basic background is engineering. So it's all about management, that how can you make your things in a lean way so that you can have spend less money to have more outcomes. So this is the way we actually apply, and we actually building things in that way. Sometimes money is not important, rather you can use your networks, your links, your like surroundings to actually achieve your small objectives without money. So that's the way you have to manage the cost.
On the other hand, I also thank Professor Mamun. He showed me how to manage fund, how to manage money from government and also from university for research and development. So he showed me, he actually helped me how to get research fund from different wings of our government, because this time our government provide many research fund. Actually, this is the research fund for doing research for our students in postgraduate level, undergraduate level also. I think if you want to do something, money is not a problem. Actually, this time in our country. Okay, I think now we need to say goodbye from this session. Thank you, everyone. Thank you, everybody. So now I would like to invite our moderator again to conclude this session.
Okay, thank you so much, sir, for your nice presentation. And now I would like to request our session chair, Professor Dr. Kazi Delwar Hussain, sir, to hand over the virtual certificate to our keynote speaker, Professor Dr. Khandokar A. Mamun, sir, as a token of appreciation.
Thank you. It's my great privilege to hand over this certificate to Professor Mamun. Thank you.
Thank you, sir. Now I would like to request the organizing chair of ICSD TIR 2021, Mr. Deepak Kumar Chaudhary, sir, Associate Professor and Chairman, Department of Tripoli, PCIU, to hand over the virtual certificate to our session chair, Professor Dr. Kazi Delwar Hussain, sir.
Firstly, I'd like to thank to Honorable Keynote Speaker, Professor Dr. Abdullah Mamun, United International University, and Honorable Session Chair, Professor Dr. Kazi Delwar Hussain, Chittagong University of Engineering Technology, for their nice contribution at this keynote session. And it is really an immense pleasure for me to offer certificate to Professor Dr. Kazi Delwar Hussain for his great contribution and countless time for this conference. Please take our certificate of appreciation. Thank you so much.
Thank you very much. Okay, thank you everyone. See you next session, next technical session or keynote session. See you again. Thank you.
Thank you all for your, thank you so much for this, all the sessions, and really appreciate all the efforts. Thank you.
Thank you, sir. Thank you very much, Professor Dr. Kazi Delwar Hussain, sir, for conducting this keynote session. And I also thank our keynote speaker, Professor Dr. Khandokar A. Mamun, sir, for managing some time for us and for the nice presentation. I hope it will be highly motivating and beneficial for all of us. Thank you, everyone. And I think this is the end of our session. Thank you, sir.
Thank you.